are you doing? Neil O'Grady is my name. I'm a registered osteopath and this is Jimmy Sullivan, physical therapist. And today I'm going to explain to you the Apley scratch test, which is a range of motion test for the glenohumeral joint or the shoulder and surrounding muscles. So first, Jimmy, I'll get you to turn around completely. And what you do is you'll ask the patient, we'll use his left arm, ask the patient to place their left arm behind the back with the thumb up between the shoulder blades, or back of the hand between the shoulder blades as far as they can. So you're internally rotating and placing the dorsal aspect of the hand in between the shoulder blades. And this is just an indication of the range of motion of the shoulder. And so what of this if let's say he can only go to here, and what would that mean? What could it mean? It could mean, so he's trying to internally rotate the shoulders, which means he's lengthening and stretching the external rotators. So his supraspinatus, infraspinatus, teres minor are all internally rotating or lengthening as he's internally rotating his shoulder. So it could be tightness in those muscles. It could also be capsuloligamentus tightness, so the joint capsule, which comprises of the ligaments and the cling film type material that surrounds the glenohumeral joint, could be tight. Or they could simply have an osteoarthritic shoulder. And what tends to happen in an osteoarthritic ball and socket joint is that all the muscles surrounding it, like a hip, tend to tighten up and the patient will lose range of motion because the body doesn't like movement, because when you roll the ball in the socket it tends to scour the joint. So it could be all of those things, one or all of those things. So then next I'll ask him to place the hand down and pat yourself on the back, so he's placing the palmar aspect of his hand between his shoulder blades. He doesn't have a lot of movement there, and what you're doing here when you're externally rotating is you're lengthening the internal rotators. You're talking about the subscapularis, so the muscle on the anterior portion of your scapula, and also your pec, major, minor, are also lengthening. So you have tight pecs, tight subscap, and the things I spoke about a moment ago, which would have been like maybe osteoarthritis in the shoulder or tight joint capsule. So that's the Apley's scratch test. That's just give you an indication of range of motion of the shoulder. And also, you can let that arm down. And also what you would tend to do is, obviously you would compare both sides. Side with the least range of motion is not always the side that is in trouble. Sometimes the dominant arm has less range of motion. So with that, you're also looking for pain, reproduction of pain, and pinching maybe in certain ranges. And frozen shoulder is another area that a person will tend to lose those motion, particularly extension and internal rotation. Okay, thank you very much.